There's a small glimmer of hope tonight, with the state's COVID cases again falling slightly. But authorities say it's still too early to tell whether the outbreak has peaked and the curve is flattening. There were 1,127 new infections reported today, 130 fewer than yesterday. Another 2 Sydneysiders with COVID have died. Some LGAs of concern want to be removed from that list, and today the mayors of those LGAs had a chance to raise their case with the Premier. State political reporter Ashley Raper has more.
These are the communities bearing the brunt of COVID, and their mayors have been desperate to talk to the Premier. Today, they finally did.
It's been a long time coming. It would have been really good if we had this meeting 10, 11 weeks ago.
On the agenda was the impact of the tougher restrictions in the hotspots.
We've been treated differently to everyone else. Her answer to that was that she was trying to protect everybody and make sure everyone was safe.
Answers to all other COVID-related issues were left to a senior public health official. A few government MPs have raised concerns that the public health orders are being applied to local government areas rather than individual suburbs, and they want that to change.
One of the factors that makes it more practical to use an LGA level is the ability for people to move about to do essential activities within that LGA.
Dr McAnulty also delivered the daily update. 2 people from Western Sydney have died. There are more COVID patients in hospital and 231 need intensive care. And cases are down slightly to 1,127.
It's too early to know if we're flattening the curve, but we're seeing pleasingly so far that cases haven't been increasing as fast as they have been.
The Premier's absence today was anticipated but still conspicuous. And the issues it raises around accountability were further highlighted by the opposition and the crossbench trying to force the upper house of Parliament to sit. The government labelled it a political and selfish stunt. It was a stunt to an extent, but those who pulled it say it underlines a pattern that's emerging from this government.
The Premier and her cabal of ministers in the crisis cabinet seem to think that scrutiny of their decisions is optional. We are gathered here in the chamber today to say to the Premier and her ministers that scrutiny cannot and must never be optional.
The sitting was blocked by the government and Parliament is unlikely to resume until next month. Ashley Raper, ABC News, Sydney.
All 12 of those mayors had a similar message from the Premier, but some made their point more forcefully than others. Let's bring in Cayman Gok at Schofields. Cayman, you're in the Blacktown Council area. What's the mayor there been saying?
Well, Tony Bleasdale has told me people here feel hard done by and the rules are too inconsistent. He says locals are trying to do the right thing. Here in Schofields, more than 90% of people aged 16 and over are fully vaccinated, yet they are living under the harshest restrictions in the state. The mayor has told me the total lockdowns of LGAs is unacceptable and the Premier must unify Sydney again. Late night munchies were a moneymaker for Wassam Shaker's chicken shop. So the curfews cut him a raw deal.
We're just really going day by day. How long can you last? How long can you survive? How long can you handle?
They're asking the same questions at the other end of the day on the opposite end of the street. This cafe in Granville used to have a queue out the door every morning. Now it's empty.
We've lost a lot of staff. Lost a lot of business. It's just been, it's been horrible.
Businesses across the councils of concern are hurting, and the mayors told Gladys Berejiklian as much in their meeting.
A lot of talk, very little commitment. Quite frankly, the Premier was given some realities today, and the frustrations of my residents in Western Sydney were well and truly expressed to her.
They're demanding the government scrap the curfew, inject more cash into Western Sydney and make it easier to get the jab.
Penrith, Cumberland and Blacktown to not have a mass vaccination hub, when you think about the populations that we represent, that's just crazy.
The Burwood Mayor wants out altogether.
It makes no logical sense that Burwood should remain an area of concern or a hotspot area.
And this is why. There were just 5 cases in Burwood yesterday. To the east, Randwick had almost 10 times as many, and in the city of Sydney, there were 36 infections. Neither of those councils are considered hotspots, but Burwood is.
I don't think Burwood should still be considered a hotspot LGA because the case numbers simply don't support it.
And we have to do this, we have to be inside, we have to do everything.
I'm at a loss as to what the original criteria was and why it hasn't been applied to other suburbs.
People in Western Sydney are speaking up. They just hope the Premier's listening. Cayman Gok, ABC News, Sydney.
New South Wales is on the verge of a major milestone in the vaccine race. 79.5% of people aged 16 and over have had at least one dose. Those figures only include jabs to midnight last night, so we may have already passed the 80% mark. That'll be confirmed tomorrow. Just over 47% are now fully vaccinated. The ACT's lockdown has been extended for another 4 weeks until the middle of October. The Territory today recorded 22 new COVID cases. The Chief Minister says the lockdown has been extended due to the number of COVID cases in Canberra and the surrounding parts of New South Wales. There are 4 new cases in the Southern Local Health District and 17 in the Illawarra Shoalhaven. 9 infections have been reported on the Central Coast and 14 in the Hunter New England region. Further inland, the Western District also has 14 new cases and there are 5 in the Far West. The situation in those remote Aboriginal communities remains desperate. The region around Bourke now has scores of cases, with residents a long way from shops and services. Indigenous Communities reporter Nakari Thorpe has more.
When COVID hit the remote town of Bourke, Bruce Shillingsworth was on the front foot. Delivering supplies to the most vulnerable.
We've still got elders, we've still got, disabled, we've still got families with children that still need assistance.
He's concerned a top-down approach to deal with the outbreak is creating problems.
We've got local police up here that are giving people fines for breach of COVID rules and regulations, and it's just from travelling from their residence to the shop, to get essentials.
The region now has more than 80 infections. A quarter of those are an hour north in Angonia. The town is in mourning after recording its first COVID death. A respected elder, a member of Bruce and his cousin, Peter Shillingsworth's family.
It's really hurting our community, it's really hurting our people.
The entire community is under strict isolation orders.
We don't have a grocery shop, we don't have a bank. I'm willing to risk a fine just to go and get food for my family because I won't let them starve and I won't see them starve.
Local authorities are working hard to turn the situation around.
Particularly through a First Nations lens. And I think, really taking those necessary steps to ensure that we are listening, that it's just not a one-way street.
Lost and delayed test results have also caused problems, but it's hoped new faster machines will ease the pressure.
Having the rapid testing is making it easier for people to get tested because they know in the next 24 hours they will have a result.
But as cases continue to rise here, communities are becoming more desperate to be heard.
It's not like our expectation is for government to solve these issues. It's you need to work with us, through us, to be able to address these underlying issues.
A plea for things to get better before they get worse. Nakari Thorpe, ABC News.